Good afternoon, everyone. My name is Faye Taxman, and I'm pleased today to present several of my colleagues who will be talking about measurement. And the purpose of this webinar is to really give us a good understanding of some resources on how to measure different concepts and ideas. So measurement is an important part of a good study. So today our presenters will be Dr. Laurie Descharme, who is the NIDA Scientific Officer for JCOIN, Dr. Rebecca Hirsch, who's at George Mason University, Dr. Ed Magaro, who's at Michigan State University, and then Dr. Harold Pollack at the University of Chicago. And our agenda today is to really talk about, give you a little flavor of what is JCOIN and what is the problem that we are addressing in the JCOIN cooperative that NIDA is funding. But really our attention is on standardized measurements and instruments. We're going to talk about some great resources that are available either through JCOIN or other types of repositories, and talk about how these measures could be used in various studies. So I'm now going to turn the presentation over to Dr. Laurie Descharme at NIDA to give us a background.
Hey, thanks, Faye, and welcome everyone. Thanks for joining us today. So as Faye mentioned, today's webinar is brought to you by JCOIN, which is the Justice Community Opioid Innovation Network. JCOIN is managed by NIDA and funded by the NIH HEAL initiative, which is a collection of research studies all across the NIH that are developing and testing approaches to prevent, detect, and treat opioid use disorder in a variety of settings and populations. So why is NIH doing research in the justice system? JCOIN's focus is really on expanding the available array of medications for opioid use disorder and testing strategies for connecting individuals to treatment services as they transition from jail and prison and other justice settings back to the community. This slide encapsulates the scope of the problem, namely that significant numbers of individuals who are involved in the justice system either have or are at risk of an opioid use disorder, and they need but often don't receive evidence-based treatment either while they're detained or at reentry, even though those treatments have been shown to directly reduce mortality and improve health outcomes. Next slide, please. So JCOIN is funding a wide array of research studies, including 12 major clinical trials, but these are all focused on different segments of the justice system, different interventions, different populations. So as a funding agency, how do we maximize the bang for our buck, and how do we address the opioid crisis given all the variability across these studies? One thing we do is we make sure every study is capturing information about certain key domains. And so that means regardless of what the project is about, whether it's a clinical trial about buprenorphine or a project testing the effectiveness of peer navigators, we want to be sure we're collecting certain things. So those include detailed information that lets us describe the justice agencies and the treatment providers that are participating in our studies, information about the treatment services that are being provided, both medication and behavioral treatments. And for community-based treatment, we want to be measuring availability, access, and utilization of services. We want to make sure we're sharing a common language around the opioid care cascade, so measuring the delivery of services around screening, assessment, linkage to treatment, engagement in treatment, retention, and long-term recovery. And we want to be measuring the strategies and the tactics that are needed to implement evidence-based treatment. And then, of course, given current events, we need to understand, and that means measure, the impacts of COVID-19 on the delivery of services and on individual health outcomes. I say all of that to emphasize that philosophically, we are coming to this from a position of valuing coordinated, if not completely harmonized measures being used across very different studies, so that we can maximize the scientific yield of these studies. So even if studies are designed quite differently, there's a degree to which using standardized measures for certain components of those studies lets us compare apples to apples across the pieces that they have in common. Next slide, please. So, standardized measures are commonly accepted ways of measuring a particular construct, and it requires you to be clear about exactly what it is that you're trying to measure. So, if you say you want to measure substance use, you need to be clear about whether you mean the quantity and frequency of a substance that's being used, how much and how often, or if you're measuring problems associated with substance use, or are you talking about measuring symptoms of substance use disorder? So all of those are constructs that are related to substance use, but they imply very different measures. Another example is income. So if you and I agree that we're both going to collect, we're going to measure our respondents' income in our studies, we need to get really clear about how exactly we're going to do that. So we could ask them to report an hourly wage. We could ask them to report total annual household income that they reported on last year's tax returns. Or we could ask how much money they received last month or last year from all possible sources, including employment and public benefits and alimony and illegal activities, right? So again, those are all very different measures, and they apply that you have a particular reason for choosing one over another. So the point is, you need to first get clarity on what exactly it is you want to measure, and then you can often identify standardized measures that are available to do what you need them to do. So in this webinar, we're going to provide some information about measures that are in the public domain, meaning they are free to use in your studies. There are also proprietary measures out there that require either permission or payment, and those may come into play particularly if you're working in a new or a less common area of research where a large bank of measures has not been established yet. Those sets of measures, those proprietary measures, are beyond the scope of this webinar, but I just wanted to alert you that they are out there, and many of them are quite legitimate for you to use. The measures that we will point out today have gone through a process of development and testing and retesting to make sure that they are reliable and valid. And whenever you're selecting measures, you should also be sure they are written in a way that makes sense and is acceptable for use in your particular study population. Next slide, please. So I've already talked a bit about what standardized measures are, but let's talk about why it's important to use them as opposed to just coming up with your own measures when you design a study. So using standardized measures helps ensure that we have consistent definitions from one study to the next, that my measure of substance use symptoms is comparable to yours. Because standardized measures have been tested and validated, we can have confidence that they are accurate and precise, that they're measuring what we intend them to measure. And they allow for harmonization, so looking at data from multiple studies or populations, and they allow for replication, being able to reproduce a study's findings by employing the same measures. From a funding agency perspective and from a taxpayer perspective, standardized measures are also important because they allow us to avoid duplication of effort and expense. So NIDA and, go back, thank you. So NIDA and other institutes at NIH have made significant investments in public access data repositories, collections of data sets from completed research studies that we make available for other researchers to analyze. And if researchers are using standardized measures, that gives us an opportunity to pool data from multiple studies and create a much larger population of subjects that we can look at. And so it lets us understand the particular phenomenon, like substance use, in much more detail, because all of those studies together collectively give us much more data than any one study would be able to collect on its own. So, if every study develops their own measures of substance use, we can't pool data across studies, and we can't easily compare findings between studies. Now, next slide. Thanks. So with all of that as a backdrop, the investigators involved in the JCOIN studies worked together to identify the components of their studies that they shared in common and could measure in common. So areas like substance use and the sociodemographics of the justice-involved individuals who would be enrolling in these studies. And we came up with a core set of measures that they all agreed to use. And again, we invested all of this effort because of the potential payoff down the road. So across a group of very large studies, we knew that having a core set of measures in common would let us pool our data to build a larger data set for analysis than any single study could enroll by themselves. And we'd be able to compare subjects and interventions and outcomes across studies. And in the end, that means the whole is greater than the sum of its parts, right? So rather than having 12 large clinical trials publish their results entirely independent of one another, we would be able to look across studies and learn how similar patients respond to different interventions, or how similar interventions produce different results in different settings. So we're making our collection of core measures from JCOIN available for you to use if they make sense for your particular population and for your research questions. This, to be clear, this is not a mandate. There's nothing required here, but we wanted to tell you how we arrived at this set of measures and then make them available in case it's a useful place for you to start. So now my colleagues and I are going to talk through some of the JCOIN measures, and then we'll go a little bit beyond that. So we'll introduce what we mean by the opioid care cascade and how powerful it can be as a framework for data collection, but also to target areas for improvement in service delivery. We will highlight a few other examples of collections of measures that are free to use and may be useful in your projects. And of course, given the nature of JCOIN, we are focused very much on opioids and justice settings and implementation of evidence-based practices. So that's what we're going to focus most on today. But you'll have a lot more measures in your own study, either in addition to these or beyond these, depending on what your study is about. So this is by no means an exhaustive inventory, but it's just a place to sort of help you think this through and get started. So I've talked enough. With that, I'm going to turn this over to Dr. Harold Pollack, who's going to talk us through some of the JCOIN core measures.
Hi, thanks so much. And it's great to be with all of you today. So I should say that we have a series of individual measures that should be quite helpful in your studies. And we have a set of baseline measures, and some of these baseline measures are things that are very helpful actually for just linking and sort of managing the mechanics of dates and things like that, and also follow-up surveys. The core items are in each of the JCOIN hub surveys. Now, some of these core items have to be slightly tailored for the local context. For example, if you're interviewing someone who's leaving a jail rather than a prison, or someone in some community corrections setting, there's some tweaking that may have to be done, but you're basically using a core measure. And there are also individualized items that are unique to each specific study that match the questions that are of interest. And the measures are included on the JCOIN Partners portal. And I very much recommend that you just go on that portal and look. You really don't want to be reinventing the wheel if you can avoid it, among other reasons, because when you reinvent the wheel, it's usually not quite round after you've reinvented it. Next slide, please. So let me say a few things about some of the standardized measures. So we have age, gender, identity, race, ethnicity, years of education, work and school situations at a defined baseline or time point. And one of the striking things about every one of these common sense variables that you want to measure is there's actually a lot under the hood about how to do it in a way that is standardized so that you can compare it to other studies, and so that you can avoid some glitches that many other researchers have uncovered through trial and error and piloting in practice. We also have measures of quality of life over the past week, physical function, ability to perform social roles and activities, mental and physical health, a whole variety of pain, of course, being important in the opioid context, previous health diagnoses. So there's just a whole series of very useful measures that we have, particularly within the core variables, where you want to understand what are people's preferences regarding what types of substance use disorder treatment they might want, what's been happening to their criminal justice involvement over the past 90 days and also in a lifetime sense. And I would really encourage you to use those core measures for that. Next slide, please. Now, there's additional data which is also standardized, but is not used by every JCOIN hub, but is used where pertinent. So, for instance, some studies have a focus on sexual and gender minorities and sexual orientation and so on. And there's a series of recommended measures for that. We also have questions about public program receipt, TANF, SSI, and DI, questions about informal or illegal income, which, as you can imagine, is a very sensitive subject, and drawing on the experience of others who have developed useful questions that seem to work pretty well in this population could be a real strength. Housing status, you can see quite a long list of issues that presumably you would not want to tackle all of these issues, but you might be interested in suicidality or questions about overdose and how those were addressed. So quite a few questions that you should feel free to draw on, including questions, by the way, this bottom bullet about how the survey was administered. Was it self-administered? Was there some other way that it was given? What was the language given? Was it in a private space? Things that you might not think about, but things that could turn out to be quite important in interpreting your study findings. Next, please. And then I believe I'm turning this over now to, am I going back to you, Lori? Is that correct?
You are coming back to me, yes. So thanks, Harold. I'm going to do a brief cameo here, and then we'll move on. All of the JCOIN studies are enrolling or capturing information about individuals who are involved in the justice system, but some of the studies are actually implementing new programs or processes. So they're trying to systematically introduce new services or new workflows into the agencies that they're partnered with. And so we wanted to capture data related to that implementation process so that we can understand some of the organizational characteristics associated with whether those changes were successful. And so we've done this in 3 ways. So first, many of the studies will be collecting data from the staff at the participating justice or treatment agencies using surveys at the beginning and the end of the research studies. And the best way to learn about how an agency operates is to ask the people who work there. So we have pulled a number of existing measures from the implementation science field to ask agency staff and to help characterize the general climate of the agency in terms of how supportive it is of implementing new practices or programs. So the JCOIN measures for staff surveys will include a set of measures that describe an organization's readiness for implementing change. So generally, how open and receptive is the environment to trying new things. The organizational climate, especially how stressful is it to work there, because a high stress environment could be a difficult place to introduce, say, a new workflow. Measures of staff's familiarity with opioid medications, that's the MOUD, medications for opioid use disorder. So do they know what those medications are? Do they think they're effective? Do they think they are appropriate for use in this population? And then again, each of the JCOIN studies is going to be testing a somewhat different intervention or implementing a different policy or practice. And so we have questions asking staff about how acceptable they perceive that particular intervention to be and how likely it is to be sustained beyond the life of the grant. So those measures are all included in the JCOIN measures that we can share with you. And I'm going to mention also that we plan to capture some additional data, and I'm just noting it here for you to consider, even though we don't have a specific list of measures to share. But if you're studying how a new policy is rolled out or how a new program is implemented, you're going to want to capture some information about that process itself. That can be a little tricky. It requires some creativity. The JCOIN projects are going to be doing things like collecting fidelity checklists and reviewing notes or other records that their project facilitators will be keeping. So literally having participants keep track of what they did and when and how to give us a window into that process. And then we can see whether it all played out the way it was designed and intended to. And then because we have projects happening in something like 87 different communities across the country, we also thought it was important to capture something about the larger context in which our partner agencies are located. So we're working out a plan to capture available data about community characteristics, so census data, what treatment and healthcare services are available in those communities, what sorts of state and local policies are in place that could dictate or could constrain how much flexibility agencies and treatment providers have to deliver certain services or change how they do business. So again, food for thought, and may or may not be relevant given your study design and your research questions, but that's something else we'll be doing in the context of JCOIN. So now I'm going to turn it over to Dr. Ed McGarrell, who's going to talk about the opioid care cascade and as a framework for study design and measurement and service delivery. So Ed.
Thanks, Lori, and good afternoon to everyone. Good morning for those of you and where that time zone is appropriate. So the next set of measures are system measures and draw upon what has come to be known as the cascade of care model. The model was originally developed as a way to conceptualize, identify data needs, assess, and improve HIV treatment delivery. Since that time, it has emerged as a valuable framework for assessing treatment needs and treatment delivery to better address substance use disorder, mental health, and co-occurring disorders in justice-involved clients. Next slide, please. Essentially, the cascade model helps us to conceptualize the touch points in the justice system where we have clients that may be in need of SUD treatment. This can occur as a diversion from arrest, where there may be direct referral to behavioral health for screening and assessment, arrest that leads to a diversion program or perhaps a drug treatment court, or clients in jail, prison, or on probation and parole. Typically, the referral to services involves coordination between justice and behavioral health agencies. And it's this interface of different systems where we often find gaps arising in terms of actually engaging and retaining clients in treatment. The model suggests we think about how we provide screening, assessment, and referral to treatment, how we increase initiation, engagement, retention, and completion of treatment. The idea of discussing the cascade model in the context of this common measures discussion is that for those of you proposing research on enhancing access or efficacy of services that involve this type of justice and treatment interface, the cascade model may point to data sources and measurement that will strengthen your research. It's also a valuable conceptual tool for helping you put together a multi-agency planning and implementation team to successfully implement your strategy or intervention. Next slide, please. The cascade model has been applied nationally based on estimates of opioid disorder needs, assessment, and treatment. As you can see in the slide, the data point to significant gaps between needs and services across these various stages. Next slide, please. One of the major efforts to apply the cascade in the justice system is known as JJ Trials. This was a major research project working in over 30 communities and applying the cascade model to enhancing service delivery in the juvenile justice system. Similar to the findings from the national estimates in the previous slide, the JJ Trial study demonstrated the large gap between treatment needs, assessment, and treatment delivery and retention. The cascade framework points to the challenges of coordinating between the justice and behavioral health systems. Next slide, please. This slide provides a definition of the measures developed to trace service delivery over the various stages of the cascade process. The findings from JJ Trials show how useful the collection of data across these critical stages for system planning and for measuring progress on the goal of increasing access to treatment and ultimately more successful outcomes. For those of you working in the adult criminal justice system, the model will be very similar, with the major difference being at the arrest, intake, or court or adult booking or jail system, in contrast to the juvenile justice system. In summary, we encourage you to consider whether the cascade model is relevant to the research project you are proposing. In the case it is, the framework and the measures that have been developed in JJ Trials and similar studies are likely to prove useful in your study. Well, if we haven't provided enough measures at this point, I'm going to turn it back to Lori, who's going to provide reference to additional resources that may be useful. Lori?
Okay, thanks, Ed. So yeah, so we've talked about the JCOIN core measures and the care cascade, which we are using as an organizing framework for addressing the opioid crisis broadly. And I'm going to take a couple more minutes to share some additional collections of measures that might be useful, again, depending on your research study and your population and the research questions that you are asking. So these are all collections that are online and they are freely available for you to access if they make sense for you. I cannot emphasize enough. It all depends on what your study is doing. So I'm going to talk briefly about 4 resources. So one is the NIH Phenix Toolkit. Then there's an NIH collection of public health emergency measures, which includes some emerging measures about COVID-19. And then 2 good general frameworks for implementation science, which also include collections of measures of their component constructs. And these are the EPIS framework and the consolidated framework. And I will say I'm about to move off this slide, but just a reminder, we will make these slides available so you don't need to scribble down all of these web addresses. I would rather you just watch and listen while I sort of tell you what's in these websites. And then perhaps if one of my colleagues could post these URLs in the chat or in the Q&A, those of you who are attending the webinar live can just copy and paste from there. So with that said, next slide, please. So this is the homepage for the Phenix Toolkit. I cannot possibly do justice to everything that is in this resource, so I'm not going to try. But instead, I just want to give you a feel for what is here and how this site works. It can be a little intimidating, but don't let it scare you because there's some good stuff in here for you to use. So the Phenix Toolkit contains sets of recommended measures. They call them protocols in a variety of domains. And these were developed by consensus with the broader scientific community, supported by NIH. And the website explains the measures and how to administer them. It provides citations so you can see where they came from, and it lets you download them easily and for free. Helpfully for us, right on the home page, you'll see the big green triangle there at the bottom of my screen, and that's their icon for the substance abuse and addiction measures section. And if you were to click on that triangle icon, you'll go straight to that section. So next slide, please, and we'll see what it looks like. So this is what that landing page looks like for the substance abuse collection, more or less. I had to arrange a few things to get them all on the screen. I have highlighted in the green box here what are called the core collection. So these are basic measures of substance use, quantity frequency measures, and lots of measures of demographics and social determinants that are known to be associated with substance use and outcomes. So basically in the core collection, they are saying this is the least you should be measuring if you are asking individuals about substance use. In the yellow box that I've drawn here, you'll see that they have what they call a specialty collection on the assessment of substance use. So this is where you can find measures for screening and assessment and diagnosis. So not just quantity frequency, but letting you get at risk and severity and the potential for dependence. This section also includes the ASI, the Addiction Severity Index, if that's of interest to you and if you need access to it. The cool thing about the Phenix Toolkit, the website, is that you can click on the blue title of the collection, any of those collections, and you'll go read everything about what's in it. And then if you want to use those measures, right there on the screen, you see the little box that says add to my toolkit. You just click that button and it puts all the measures from that section into your cart, just like you're shopping on Amazon. So you browse through the site, you select items you want, you add them to your cart, and then when you check out, all of the items you chose are available to download with all of their documentation, and off you go. So there's much more than substance use in the Phenix Toolkit. So again, depending on your research question, you might want to look around in here for measures related to mental health or social determinants of health or other health conditions. Just a reminder, this is an NIH website, so it's all focused on individual level health conditions. Next slide, please. Thanks. So I'm only going to focus just a minute on this slide. Obviously, COVID-19 permeates nearly every aspect of our lives at this moment. So it's so new that there is not an established literature that we can turn to for a list of measures or to see how they've been used in other studies. NIH uses this particular website for a variety of research and training resources related to various public health emergencies, of which COVID clearly is one. And so this is where they are accumulating COVID-19 data collection tools as we learn about them. You will also want to check in the Phoenix Toolkit for COVID-19 measures there, but this particular public health emergency website is probably closer to real time in terms of gathering measures that are being used by researchers right now, so I would recommend checking here as well. Next slide, please. Okay, and then I promised I would show two resources in the area of implementation science. Most of this is well beyond the scope of what we can do in this webinar, but suffice it to say, this perspective is useful for when you are studying the process of implementing a new program or the impact of a new policy. This first one is the EPIS framework. EPIS stands for the 4 major phases of an implementation process: exploration, preparation, implementation, and sustainment. And the website nicely lays out the processes that are likely to be happening in each of those phases that you might want to measure, and it suggests measures for each of those domains. It's well laid out, it's easy to understand, it's easy to use. Next slide, please. And then another implementation resource. I mentioned both of these because they're both really good and easy to use resources, but they take a slightly different approach, so it's worth looking at both of them. This one is the Consolidated Framework for Implementation Research, which was developed by researchers at the VA. This website not only provides sort of an overarching framework for understanding the implementation process and all of its major components, but it also provides some good resources and recommendations for how to select an evaluation design, how to choose an implementation strategy, and how to measure all of it. So again, easy to digest, free to use, and just a good all-around resource if that's what your research question calls for. Okay, so that completes our measures tour. So that's our brief overview of the what and the why and the how of standardized measures, at least as they relate to the work we're doing in JCOIN. And with that, I'm going to turn it over to Dr. Rebecca Hirsch to take us home.
Thanks so much, Lori. Thank you to everyone for joining us. Again, we have provided so much information and so many measures that you'd think that we want you to measure everything, and we do not. That's the sort of the take-home message from this is do not try to measure everything. Really need to consider how the instruments you choose will have an impact on really the burden on the respondents. I mean, the more measures, the more questions you have, the less likely your respondents are to finish that data collection, to finish that survey, or to attend each individual question. So do really think about the burden that you are placing on respondents. And whether or not the measures that you're choosing are able to measure the key constructs, the key things that you want to address, the questions you want to answer. Again, this relates to the appropriateness for the study goals. What are your questions? And what do you need to ask in order to get the answers to those questions? Indeed, what you measure should be consistent with what you want to learn. So understand what your questions are, and then look for those measures that can address those questions. So I'll say it again, do not measure everything just because you have a captive audience. Do think through very clearly what you want to measure and how you want to measure it. If you have questions about how to choose a measure, how to think about your constructs and what measures would be most appropriate for that construct, please do send us an email at the jcpilot@gmu.edu. We can address your questions, or you can get specific technical assistance and really think through your study protocols, your ideas, the questions that you want to answer. And we can help you think through really where are the best measures for that. And with that, it is now time for your questions. You may have been populating the Q&A box. I will turn that over a little bit to Faye and Cameron if there are specific questions that are in the Q&A that we can address live now.
Thank you, Rebecca, and thank you to our presenters. So we do have one question. We have a question from Dr. Carroll, and she indicates that she's had numerous NIH-funded mentors tell her that CFAR is enormously unpopular in HIV research, and using that framework for assessment will tank your review. Is that accurate? Is that a limited phenomenon? And then she goes on to ask, basically, I'd like to know what assurances JCOIN can offer that employing CFAR as a framework in our application is a safe thing to do, as I have been strongly counseled elsewhere against using it. So I'll begin to answer that question, then I'll turn it to Lori. So from my experience as a PI on a number of NIH grants, the framework you select to use should really be be compatible with the study that you are using. And the rationale for using that framework is something that you need to adequately describe, or more than adequately describe in your in your application, and also the rationale for using that. I would also recommend in any framework, whether it's EPIS or CFAR or REAIM, that you essentially identify other similar studies that have used those as a way of documenting the relevance and utility of those particular frameworks. Lori, do you want to add to that as your role as a scientific officer?
Sure. So I think it's an excellent question. I don't want to get into it on this particular webinar about the intricacies of the NIH review process and how different review committees have different perspectives. They absolutely do. That's an absolutely valid observation. And so, I will say that in the context of JCOIN, if we're talking about drug abuse studies, if we're talking about implementation in the sphere that JCOIN is working in, I think, well, first of all, if we're talking about implementation science, any framework is better than no framework. We want studies to be conceptually grounded and have a framework that are driving their questions and their measures and their design. That's not to say that any framework is appropriate for any study. So, I will offer, I'm sorry, the name has gone off the screen. I will offer for the person who asked the question, if you want to contact me directly about an NIH application that you're thinking of submitting, I'm happy to talk you through it, and we can talk about the pros and cons of those things. So yeah, there are some vagaries about the review process at NIH, but specifically if we're talking about JCOIN, these are some of the resources we wanted to highlight because I think particularly for people who are new to the field, those resources, the two that I mentioned, the EPIS site and the CFAR site, also give you a more holistic picture of not just a framework, but also how to select measures, how to select research questions, how to select study designs, and sort of think through at the big picture. So that's really why we offered that. But again, the offer stands if you want to contact me directly. I am absolutely happy to talk you through it.
And Dr. Carroll says thank you. She will be in touch. All right. Are there other questions from any of the attendees or the panelists that anyone would like to raise? We don't have any other in the Q&A.
The only thing I would say, I would just encourage people to go and look at these question batteries as you're designing your studies, because you also get good ideas seeing some questions that you wouldn't have thought to ask. And then secondly, when you're done, if you haven't dropped some question that's really interesting, but that you just don't have space for, you probably haven't been ruthless enough in terms of respondent burden and things like that. So you really do have to be disciplined so that you can get a high quality experience for respondents with a high response rate. And so you just can't go kitchen sink in this mode and expect to get the kind of response rates that you're going to want.
It's both response rates and useful data because, you know, oftentimes people will get fatigue on these surveys that we do. So, yeah.
Absolutely.
All right. Well, I do not see any more questions. As Lori has indicated, we will have a copy of the slide deck available. It will be posted on the JCOIN website. I provided for you a sign up, which means that you need to register with that website, and then you'll be able to get access to a ton of different information that we're putting on that website, including the announcement for the JRIG, applications and a copy of this presentation.